20 years ago, a former oncologist at Montefiore Einstein Center for Cancer Care began to hold breast and cervical cancer screenings for the Bronx community. And on Saturday, October 7th, marks the 10th anniversary of the event in his name. And joining us now to tell us more, we welcome medical oncologist at Montefiore Einstein Center for Cancer Care, Dr. Jesus Anampa Mesias. Hello, good morning.
Good morning.
Good morning, and thank you for being here.
No, it's a pleasure.
And
Thanks
thank you for the work that you do for us women, right? Let's talk a little bit about this screening and just, I guess, what inspired this particular doctor to create it.
So, well, as you know, Montefiore serves the population with the Bronx, and unfortunately, not everybody has access to screening. As you know, cancer is a very common disease here in America. Breast cancer is actually the most common malignancy among women. About 250,000 women will be diagnosed with breast cancer every year. 40,000 would die. So it's very common, and we need to detect it early. So that's why we started this program.
Okay, so this was Dr. Edward E. Greenwald that started this particular screening, right? And so just in general, just because you're an oncologist, I think I can ask you this question. Why do you think that cancer has become so much more common in our society?
Well, a few things happen. People are living longer, and age by itself is a risk factor for cancer. Second thing, all the chemicals, nutrition, diet, all those things have changed, healthy habits that we used to have before. So, and that's also, accounting, also the global warming is accounting for skin cancer. So there's multiple factors accounting for the increased rate of cancer. And also, now we have tools to detect cancer. In the past, people would die at age 60 or 50 and they didn't know if they had cancer because we didn't have the tools. Now we have the tools. So it's a few things that account for this reason.
So as a woman, how often do you recommend women screen themselves for cancer?
So since cancer is very common now, at age 40, the women should discuss with their primary care about screening with mammograms every year. Women from 45 to 55 should have a mammogram at least once a year. And depending on any findings there, after 55, women should continue screening as long as they have a healthy and life expectancy more than 10 years.
So in the screening that you're going to be offering, is this a free service?
Correct. That's the beauty of this. So this is for people even without insurance, they are more than welcome to come, and we'll provide them with breast cancer mammograms and also with pap smears, with both.
Right. So it's through pap smears that cervical can be caught.
Correct.
Right. So just because I'm just really, for lack of a better word, fascinated with the fact that cancer is just it's like a dominant disease within our society, and it just like sprung in like a matter of years. And I'm just wondering, these are just my theories. It's like, does microwaving food play a factor?
More than microwave food, the food that we eat, like canned food with a lot of, condiments, a lot of chemicals, canned food, those are dangerous for people.
Okay, so when you say chemical foods, are you referring to not purchasing foods that are organic?
Correct, like canned food, for instance. Canned food has a lot of salt, a lot of chemicals inside. Instead of having real fruit, real vegetables, like they're healthy. They don't have these chemicals that can increase cancer.
So is cancer also something that is genetic?
Correct.
It is.
Not all the cancers, but a few amount. For instance, in breast cancer, about 5 to 10% of cancer are genetic. So they're running families, but still 90% are sporadic, meaning come out of the blue.
So let's talk about the machinery and the technology that Montefiore has to do these mammograms, because I know that there's different versions. I'm one of those women that does check myself regularly, and where I go, they have like these 3D scanning. It's the most uncomfortable thing in the world, but the point is that they can really look inside and see everything that's in there through images.
That's a great question. So the 3D scanning or 3D tomosynthesis mammogram actually is something that is now moving up forward, because it gives you a three-dimensional view of the breast. So you can see not only, a panel of 2 dimensions, but 3 dimensions, and that can help you to make a decision about going for more scanning, an MRI, or even a biopsy. So even though it's not standard of care, we do have that, and it's moving forward. So in the next couple of years, we expect that these 3D mammograms should actually become standard of care.
So what percentage of women of color are diagnosed with cancer?
So out of 100% of women, I would say half of them are either Caucasian, and then the other half are either black or Latino.
So it's half and half.
Kind of, yes.
Right.
It depends on where you ask. In the Bronx, we have a lot of, African Americans, Hispanic communities. So we have a higher incidence in those. If you go to our areas where they have less people, then they will have small amounts of those.
Well, I'm really glad you're here sharing this with us, and I would like to encourage anyone who's watching this to not be afraid and take advantage of this opportunity of free screening. And if you could just share all the details that are going to happen on October 7th, that would be greatly appreciated.
Thank you very much. So the Montefiore Einstein Cancer Center event will happen at 1695 Eastchester Road, and it's from 9 o'clock. Everybody's welcome, regardless of the insurance. Just bring an ID, and you will get mammogram or your pap smear. You will be seen by medical oncologists, gynecologists, oncologists. There's a big team there that will see you as well. And you just need a form of ID or a telephone so we can contact you if we have any abnormal findings.
Beautiful. Thank you so much, Dr.
Thanks
Anampa.
for the invitation.
Is it Dr. Anampa or Dr. Mesias?
Anampa.
Anampa, so it's Dr. Anampa. Thank you so much for being here with us and sharing this information with our viewers. And you guys, listen, it is so important to get yourself checked out. So if you want to partake in either breast or cervical cancer screening free of charge, make sure you stop by on Saturday, October 7th from 9 a.m. to 1 p.m. And that's happening at Montefiore Einstein campus, which is located on 1695 Eastchester Road in the Bronx. And for more information, you can visit montefiore.org/cancer.